Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you for joining us again. This evening, we're going to have a conversation with Dr. Marcia Brose, Associate Professor at the University of Pennsylvania School of Medicine, and she's joining us here on Health Professional Radio to talk about the role of cancer genomic testing and NTRK, gene fusion. Welcome to Health Professional Radio, Dr. Marcia Brose. I'm glad that you joined us this evening, and I'm going to let you explain that to us, NTRK gene fusion, after you tell us what your role there is at the University of Pennsylvania.
Sure. Thank you for having me. My role is the director of the Center for Rare Cancers and Personalized Therapy at the Abramson Cancer Center. And the role I have is I do research for patients who have advanced cancer that do not otherwise have cures. And my focus, I have a PhD in genetics, and my focus is on trying to identify patients who have underlying gene mutations that might identify them as particularly well treatment with some of the new agents that are coming out. And the subject of today, of course, are NTRK, which we actually call in the business NTRK. NTRK fusion is a gene. It is caused by one of three genes breaking in half and fusing with another gene. And what happens when that occurs is that the NTRK signaling ends up being turned on when it normally isn't turned on. And because of that, that's probably the underlying reason why people had the cancer. And when people have that cause of a cancer, when that's the reason why their cancer develops, it does actually identify them as very good candidates for treatment with a TRK inhibitor, an inhibitor for the TRK protein.
Now, is this protein or this gene present in any type of cancer, or are there certain types of cancer where it's seen more?
Well, it can be seen more or less, and it depends a little bit on what population you're looking at. Okay. For instance, if we take thyroid cancer, it's fairly rare probably across all thyroid cancer. But when we take patients who are radioactive iodine refractory, they haven't been cured by surgery, radioactive iodine no longer works, it's probably a little bit more common in that subgroup. So, in patients who have advanced thyroid cancer that's not otherwise cured, it might be a little bit more common. And we actually have seen it there and actually have seen amazing results with the TRK inhibitors in treating patients who we found the fusion.
Now, obviously, at some point, we are, hoping for cures to these cancers that aren't otherwise curable. When these patients have these cancers that are otherwise incurable, are we looking to better the treatment of a cancer that we know is going to have, the mortality rate, whatever that rate is? Are we looking to pinpoint treatment?
Well, so that's a really good point, because the majority of patients will do very, very well. The cancer, sites wherever they have it will definitely will virtually always shrink significantly. But unlike other kinase inhibitors, we actually have seen patients where we can no longer detect their disease. Mm-hmm. And so we might be starting to get into that realm where we are actually curing patients. It's too early to say yet, mm-hmm. but the results are starting to go in that direction where we've seen quite a few patients where we can no longer detect disease in people that we never saw that before. At best, we hope to stabilize their disease, maybe make it a little bit smaller. Now we have patients where we don't even find it anymore. So it's not clear if those are cured yet, and we don't know really that much about what happens if we were to stop the drug, if the cells are still there and could regrow. There have been some situations, especially in children who have specific sarcomas, that have been able to be cured where before they might lose a limb because they've got a cancer in, a leg, and they're able to get this medicine, shrink it enough, and then the surgeons were able to go in and do a complete surgery, whereas before they couldn't. And in so doing, basically save the leg, save the patient's life, and there now no evidence of disease again. So it's too early to say the C word, meaning the cure word, mm-hmm. but we are having some very, very good responses where at least we're getting some patients, not all, but some patients to a point where we cannot detect the disease. And that's just amazing.
Now, identifying these patients, that has to be a challenge. Now, Bayer and Neogenomics Incorporated have launched a test for TRAC. Now, I understand that it's NTRK. I guess the program is Test for TRK. Is it Test for TRAC?
Right. So there's actually 3 NTRK genes. So it's it checks for all the fusions for all of the NTRK fusion genes. And the idea of that is that we now have FDA approved. We've got 2 NTRK inhibitors, both larotrectinib and entrectinib, that have been FDA approved for these patients. But now what is starting to become the rate limiting factor is whether or not they can actually be detected. And because they're not super common, it's getting hard to get the insurance companies to jump on board and say, well, we're going to check for these. And in addition to which, we have not historically checked for fusion genes for more than a few years regularly, and that's usually only in a few centers. So we really need more information on, if we take all the people who have advanced disease, what is the rate, and try to find out, how that rate would fit in then to what we would recommend for treatment. So it's going to do 2 things. It will provide testing for people who may otherwise have trouble getting it because their insurance won't cover it. And it will also give us an idea in certain populations what is the rate.
What type of candidates do you pinpoint? How many candidates are you actually going to be able to test? So
I'm actually not testing them myself. That's a program that Bayer and Neogenomics is actually doing. So I refer you to their website to get all the information specific to the program and exactly how many they're testing. That's not something I'm actually doing myself. But I will say that anybody who has, and for this program, I know for a fact that anybody who has non-curable metastatic colon cancer or metastatic thyroid cancer is eligible to get this testing. And so that's the first 2, at least for this program. We don't know if this program is really successful, if it will be able to extend into other tumor types. We know that TRK fusions are found across all tumor types. And if it were me and it wasn't about insurance, in my practice, I regularly would check both point mutations and fusion testing in any solid tumor patient where they're not curable.
How do you?
That would be the ideal from my perspective.
How do you start the conversation with your healthcare provider about this type of testing to find out if they are knowledgeable and aware, or can refer you to someone if that is important to the patient?
Well, I think that if patients hear about it or if providers hear about it, the most important thing they need to know is that they can follow up. They can follow up with the program, the Test for TRK program, and look into whether or not that can help them. It may be that their insurance would already cover some sort of genetic and genomic testing. And I think the first question should always be, in any patient who is not going to be cured and their doctor has told them that they're not curable, their next question should be, can we check the genetics on my tumor? And that's how I would start the conversation. And then they can go from there and look into what would be appropriate. You mentioned a website in our conversation earlier. Could you give us that website again? I think it's called Test for TRK, TEST, the number 4, and then TRK. And that would be a .com, right? Correct. Thank you so much for joining us here on Health Professional Radio, and hoping that we'll talk again. Me too. Thank you very much. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Marcia Brose. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.